Hi guys, welcome back to episode number 10 of our Strategic Hiring Tips mini-series. Today we're discussing the difference between a working interview and a skills assessment. Typically in our industry, after you've narrowed it down to your final candidates, you ask them to come in for a working interview because you want to make sure they are who they say they are and have the skills they claim to have. But most of the time, you're already shorthanded and you're using this working interview as if they were a hygienist or an assistant or an admin for the day, getting them to jump into the clinic and run their own column. This may seem like a great idea, like you're killing two birds with one stone, getting coverage for the day and testing your new candidate. But let me ask you, how are you really testing them? You are leaving them unsupervised to work on your patient. Let's say that they're a hygienist. How do you evaluate their treatment planning or communication skills or their clinical skills when you're leaving them alone to run their own column? You are relying on your patients. Are you relying on your patients to come and give you feedback, tell you how the hygienist did when they were probing or scaling their teeth, or how the hygienist was able to review their x-rays and notice that their filling is failing and now needs further treatment? No way. How's your patient supposed to know this? Only you can be the real judge on that part. There are way too many risks associated with working interviews, and you are not getting the full scope of their skills in this fashion. Working interviews put you at risk and can expose you to some serious liabilities. Like, what happens if a hygienist gets hurt during their working interview? What if they file a complaint after not being hired by you? What if they hurt a patient, or what if they cause a HIPAA violation? Your practice is completely unprotected. So now you're probably wondering, what do I do then? How do I make sure that this candidate will actually be a right fit for the office? For those positions where evaluating specific job skills are important, you will now want the remaining candidates to come in for a skills assessment. A skills assessment is different from a working interview. It doesn't carry the same workers' compensation and unemployment insurance risk found with a typical working interview. The basic parameters of a skills assessment include time being spent in your office, about 1 to 2 hours. They're not replacing a regular worker and not performing productive work. Rather, a skills assessment is a great alternative to get an idea of their skill set. For example, this is an admin position. You create a mock patient, including the financial and insurance information. Get them to walk you through how they would handle collecting an insurance check. Or if this was a hygienist position, ask them to give you a preliminary oral exam. How would they explain treatment to you? Or if this was an assistant, ask them to set up for an endo appointment and get them to walk you through the procedure, even explaining post-op instructions. This helps you evaluate their skills, their communication, and customer service, all while avoiding having them work on your patients and seeing confidential patient or business information when they're not even an employee yet. Next episode, we will dive into another tip on what else can be done to help mitigate your risk and avoid making a bad hire. Stay tuned. Thanks, guys. Have a great day.